Is it your first time in getting lip filler? I've got 5 facts that you should know before you get your lips done.
Just watch me now. Just watch me. Just watch me.
Welcome back, guys, to my YouTube channel. For yous who don't know me, I am Nurse SarahLouise. Before we deep dive into 5 side effects that you should consider before getting your lips done, what actually is filler? So filler is actually a non-permanent gel that is injected into the face. This can go in multiple areas, including the lips, the cheeks, the tear trough, anywhere that you want to replace fat. Now, they all come in different consistencies. So you've got thicker to thinner, the easiest way to understand this. And it's actually squirted out, and the gel can be in different levels of consistency. So when the thickness will go into the more denser areas, the thinner products would go into the more finer areas like the lips. When we're considering having these, we need to obviously address the side effects that can come with injecting your lips. So how much lip filler do you need during your treatment? Usually the maximum amount of lip filler I will ever use is 1 ml per treatment. The reason for this is you want to reduce the risk of migration. Migration meaning your filler ending up outside your lips because you've got too much inflammation, too much swelling, bruising, lumps, bumps, the list goes on. It's very effective to stay with no more than 1 ml in your first and subsequent treatments so that you can avoid getting all these nasty side effects. This is called vascular occlusion. This is the #1 complication you do not want. This is where filler is injected into the artery that supplies your lips blood. Makes sense, right? We need blood in our tissues. If you go and inject into that artery, you're going to block the artery. One of the most underrated but most important factors to consider when having your lips done is the technique. You have probably all seen the crazy Russian lip technique and how that ended. Not good. I want to explain to you what techniques you can have in order to get a really nice aesthetic outcome. Instead of using a vertical puncture wound technique, which can be used in the Russian technique, we also like to mix this with a horizontal technique. The downside of using vertical injections over and over again is the fact that you will have a lot of trauma, a lot of swelling, inflammation, bruising, and the ability for the filler to trace behind the lip and come up into the perioral region. This is not going to have a nice aesthetic outcome. If you use these sparingly and you actually mix these vertical injections, don't come outside the nostrils. Now, it's important to mix this with the horizontal injection and taper the lip out. This will ensure you get a really natural and evolving lip to the corners without turning the lip out and looking ducky. By using these different techniques, you can also use different densities of filler, and this will ensure it mimics your natural lip shape and equally have a nice plump and soft lip. What if I told you you can get your lip filler at your local butcher? There is no licensing and no regulation in the UK in medical aesthetics. This is really important because this promotes the accountability you need to take when choosing the right practitioner. You need to make sure that you go to a medical professional that can actually solve a complication if necessary. We're using prescription medications. We need these drugs. If we need to make them reversed, we can do. Always look for someone that has got experience with a portfolio of before and after photos. This is going to show you what exactly the results you're going to achieve and if they align with what you are wanting to look like. If you don't want to end up like those crazy images on TikTok with the lips that go absolutely huge, follow your post-procedure instructions. Key points to take away: do not exercise for the first 24 hours after your procedure. Do not apply makeup for 24 hours. Do not kiss and do not smoke cigarettes. These things can all reduce your swelling, your inflammation, your bruising, and also the risk of your infection. Make sure they stay well hydrated, drink plenty of water, and after the first 24 hours, you can enjoy them. So before you all run off to get your amazing lip fillers, please remember, know your practitioner, know your product, and understand all of your post-procedure instructions. And that way you can have healthy, subtle, but beautiful lips. Thanks again for tuning in to my YouTube channel. Don't forget to like and subscribe so that I can produce more content for you like this. If you have any suggestions, any other procedures you want to know, what you need to look out for next time, please drop a comment in the box. And don't forget, always protect your investment, guys.
Just watch me now. Just watch me.